WHO defines health as the state of complete physical, emotional, social well-being and not merely the absence of infirmity or disease. In this regard, sexual health cannot be underestimated. Sexuality is a natural part of our lives, an essential part of our emotional and physical health. Being able to experience sexual pleasure, satisfaction, and intimacy, the modern trend to see who is more sexually active and the search to satisfy our partners has dominated our land.
A primary ritual na school na boys say namfo di edrowe hu adanse yede e kire me say edrowe kama na mo di hu adanse kire na boys so no twa boys sensem ana me yede me kotobi na me numbi na me fa me girls me fa na mtum say am fa girl na yede am fili na the next day no me free girl na say girl na mbra girl na ka kire me so oba ana me numbe dro ni bi ana me twan girl na sa me sa free girl na ka kire so mo mi yede osman no market after me was me be ma so regina so sa 24/7 bra nya izo 24/7 be ma intimi nda akọ dware 3 times still na sere me be ma ne ya na nti edro we de enyama ye youth na ye sorry no ehia ma ye say be nom say edro de they are for ba.
It has no age boundary. Both the old and the young are included. STDs, congenital malformation, hormonal imbalance, aging processes are leading people to the path of aphrodisiacs. Aphrodisiacs has been present in our society from time immemorial, according to a pharmacist.
Aphrodisiac, I would say, is any chemical or any entity. It could be food, it could be plant, it could be a drug that would increase sexual desire, increase sexual behavior, or possibly increase sexual performance. Because aphrodisiacs may come in different forms such as food or plant parts or even as drugs, the method of administration would normally follow the trend as we'd always known. It could be ingested as tablets, it could be taken in as food, or it could actually be chewed. So any way that it can get into the body, but mostly it's administered through the oral route, that is through the mouth. And then some people may also take it as injection. Aphrodisiac is becoming quite common due to advertisement on radio, television, the social media, everywhere. So people who don't really need it are becoming, I would say, addicts because of the prevalence of aphrodisiacs on the general market. I am Professor Isaac Ayensu, the chairman of the Academic Research and Social Pharmacist Association of the Pharmaceutical Society of Ghana. My advice to the youth is that until you are diagnosed with sexual dysfunction or erectile dysfunction, please stay away from aphrodisiac. The risk involved in the use of these products far outweighs the benefits you so desire.
Research has proven about 20 to 30 million men suffer from some form of sexual dysfunction, especially in the middle and old age, and there are numerous effects of the use of these aphrodisiacs. Family and friends have been topmost advertisement agencies for fake aphrodisiacs, with the media being the foremost. The danger is that while some prefer to take local or herbal drugs with no dosage, others also prefer to buy it over the counter without prescription. The patronage of these drugs can lead to serious problems. There is undeniable fact that the efforts are numerous. Erectile dysfunction, cardiac arrest, headache, muscle pain are just a few of them. According to a urologist,
I'm called Dr. Fanny Vimanfet. Aphrodisiacs, generally speaking, have two main ways of acting. They can either act centrally in the brain or locally at the target organs, which are the sexual organs. At the target organs, they help increase blood flow to the organs, which helps to stimulate arousal for sex. And for the brain, it helps with the production of certain hormones which are associated with sex, and that gives the person the drive. With regards to the side effect of aphrodisiacs, management of side effects of aphrodisiacs is case specific. So depending on the drug in question and the specifics of the patient who presents with the condition, they will be managed accordingly. We have a class of drugs we call anaphrodisiacs, which counter the effect of aphrodisiacs. An example of such are anti-androgens, which are usually given to sex offenders to help decrease increase their libido. Also, an example of a drug like Viagra, where you have a lot of young people who take it without needing it. The management in this case firstly would have to be non-medical, where would resort to counseling. A lot of young people who take this drug do not need it, and they have already hormones in adequate levels for every sexual experience they may need. So counseling needs to be done to educate them on the side effects of abuse and the fact that they do not need this drug. In the case where a person presents with priapism, which is a sustained erection of more than 4 hours, then the person will be managed based on if it's an ischemic or a non-ischemic sort of priapism.
The efforts of FDA to curb the influx of these fake aphrodisiacs in Ghana is a battle far from won. The best way to stay fit sexually is to eat balanced diet and exercise regularly. If you have any sexual problem, why not visit your doctor for proper medical treatment? Stay healthy, stay happy.